Hello and welcome to Weekending. This week we focus on the baby boom in the country amidst the pandemic. According to UNICEF, India is to record the highest number of births in the 9 months since COVID-19 was declared a pandemic in March, with more than 20 million babies expected to be born in the country between March and December 2020. We begin this week by meeting a mother of a 2.5-year-old and a 1-month-old baby, Tara Singh Vachani. Tara, how was it being pregnant and giving birth during the pandemic?
Pleasure to be on, Ambika. It was actually a very interesting experience. Obviously, there was a fair amount of anxiety on, how we were going to control the experience in the hospital, who are we going to interact with. But we put a lot of processes into place, and I think we were very fortunate in the experience of the delivery, and we were home in 3 days. So it was definitely difficult and very different to how my first one was born 3 years ago. But we managed with a lot of planning.
Your advice to expectant mothers?
Sure. I think it's very important to stay busy, both mentally and physically at home. I think exercise was very, very critical for me. If it's just walking around your house or your apartment, if you have stairs in your apartment building or your house, online classes for physical fitness, there are lots of them. There's some wonderful prenatal trainers out there as well. 2, I would say read. 3, definitely have some sort of breathing pranayam practice. That was something that really helped keep me centered and not worry about what was going on in the outside world. And 4, find those 1 or 2 relationships that you trust enough to engage with physically, because I think that's what keeps your cheer up and your mental health strong, because it's very important for you and your baby to feel joyful. And then just listen to really good music whenever you can. That's something that helped me as well. I, danced with my toddler every evening, which was really fun. And that really builds the endorphins and keeps your adrenaline going. So I think keeping busy and engaged and using this time wisely, because, you're not influenced by the crazy pace of normal life. So you can actually use it to your benefit, rest well, eat well, and make the most of your time. And there's so much learning at this time online as well, that I think that's also something to keep yourself busy.
Thank you so much, Tara, for sharing your personal journey with us. According to UNICEF, in the year 2020, new mothers and newborns will be greeted by harsh realities. These include lockdowns, curfews, health centres being overwhelmed with response efforts, supply and equipment shortages, and a lack of sufficient skilled birth attendants. To discuss the changing world of parenting, we have with us Dr. Mahesh Balsekar, a paediatrician with 3 decades of experience. Nithyas, she is a Bollywood film director and screenwriter who has worked on films like Ang Lee's Life of Pi and Meera Nair's The Namesake and The Reluctant Fundamentalist. She joins us in the capacity of a young mom of a toddler. We also have with us Shabri Bhattacharya, a family therapist. Thank you so much for joining us. Now, India is witnessing a baby boom this year for all the wrong reasons. India calculated in May that about 25 million couples could have possibly been cut off from contraception access during the country's lockdown. Doc, do you agree that there is going to be a baby boom in India, and what's your advice to all the new moms?
So when you say baby boom, it's a little misleading because it sort of indicates that it's a planned pregnancy. But what we are finding here is that most of the pregnancies which have taken place are unwanted pregnancies, lack of contraceptions, no abortions, and the medical situation as it is. Now, a lot of parents are obviously going to be very anxious about what's going to happen when they deliver. The good news is that so far there is no evidence that COVID affects the fetus in any way. It's too early to say because the epidemic has started only early this year. The good news also is that if you do get COVID in pregnancy, the risk to the mother and baby is very low. And we've had many pairs of mothers and babies with COVID deliver with us, and the outcome has been uniformly good. So that is the good part.
All right, that's great news. Nitya, as a mother of a 10-month-old, does the current scenario worry you?
I want to start by saying that I feel like I'm very underqualified for this panel. But because I have a 10-month-old, so I've never known life with a child who's not been born in the pandemic. My baby was 3 months old when the pandemic hit, so I feel like I don't know it any other way. Vis-a-vis the baby boom, I think I know a few people that did get pregnant. I think what Dr. Balsekar is saying, yes, it was unplanned pregnancy. Vis-a-vis my baby, I think I managed to work from home and yet spend time with him, which was great. But I come from a privileged place, and I know how hard it is for working moms to be sitting at home and working at the same time and looking after their kids. So yeah, it's been a mixed bag, I think.
All right. Shabri, if the earth is going to have lots more pandemics as per the World Health Organizations going ahead, how do parents and kids under 2 to 3 year old cope who don't have access to play dates or birthdays or those germ infested play areas? Isn't socializing with other kids from 6 months onwards important for development? What's your view?
So my view with younger children, they don't actually for themselves need to interact with other children so much. They only start interacting largely later. It depends, of course, on the individual nature of the child, but it depends when they're 4, 5, 6 is generally when you see a lot of interactive play and they start needing it. So I think as a new mother, a new primary caregiver, one of the things that we will miss is that if you've been raising your child in this environment, you don't have the social structure that, play dates and, just having other social interactions with other children brings for you as the parent. And that's something that I think most primary caregivers really rely on, knowing that there are other parents out there who are going through the same thing and they can just sit for a little bit and let their child be and engage in whatever way they do. And that's something that we're definitely going to miss going forward.
Nitya, what are you doing to make sure your 10-month-old is socializing? Which route have you gone with?
I'm just really proud of myself, I have to say, because I think without knowing about this bubble, this social bubble, I think that I set out to actually create it. Vis-a-vis grandparents, vis-a-vis certain friends that I know that have been within the house. And I think that really helps because I know that as a 10-month-old, I don't think he's interacting anyways with other children, but it's important for him to meet, besides the parents, it's important to meet other people. And I remember the first time, I think he was 7 months old when we kind of, took him out, like some friends came over and he was quite alarmed at new faces. So I think that really pushed me. And to be honest, I've not been as pessimistic about the pandemic because I have a lot of faith in science. I have a lot of faith in medicine. And slowly, we have to get our lives back. I also went out for the first time. He was 8 months and I went and shot a short film. I had to live in a hotel because I couldn't come back to him. But I think that was also very important for my sanity as well as for him to know that I have a certain routine. Like what Dr. Balsekar says, I did read about a routine and he is very much in a solid routine right now with playtime, with his food, with his sleep, etc. And slowly I am opening him up to the world a little bit with people that I know that have been extremely careful. So yeah, these are strange times, extremely strange times. So I'm living and learning, basically.
All right. Is the pandemic an indicator of things to come, and are the rules of parenting changing?
So I think the first question is that if you look at the number of pandemics in the last 10 years, you had the SARS and the MERS and the Zika and the Ebola and now the big one, the COVID-19. So if you see in the last 10 years, we've had at least 6 outbreaks which were dangerous for the entire world. So I think there are reasons for this. And the reason is the large population, the overcrowding, the mixing with animals, the climate change, and of course the travel, which makes people travel from one part to another, so infection spreads very quickly. So I think it is now accepted that pandemics and outbreaks are going to be part of our life and we have to be prepared for it. The only important thing is that the government hopefully will rise to the occasion and awaken after this rude shock. Means after the Ebola outbreak, the WHO and the CDC and they were all talking about how we should be prepared. But when the really big COVID-19 came, everybody was caught unawares. So I think we have to really learn from this and prepare. And the preparation will be at the government level, at the institutional level, at the family level. We all have to be a little careful and expect these changes in the years ahead.
All right. Shabri, you are dealing with a lot of families during this point. What are the key problems that they are facing when it comes to toddlers?
So, some of the key is the fact that there's very little access to family, and even if there's a safe bubble, access to grandparents or other family members are extremely limited. So toddlers have a lot of energy, and how to expend that when we're all shut down and when we have, most of us, if we live in small spaces, then it becomes doubly difficult to get those children to exercise, to be able to do those things that they would normally do. So these are things that parents are dealing with.
Doctor, I spoke to a few parents who have young children, and these are the questions that they raised. With a 6-month-old to a 2-year-old child, wearing a mask is not feasible. So is it safe to take them to a park where others are not wearing a mask?
So under 2 years, it is not permitted to wear masks because it is not safe. So it is possible and okay to go out only if you can ensure safe distancing. We know that the risk of infection outdoors is much, much lower. So if you can reach an outdoor space safely and maintain distances, it is all right. But if there's any doubt, I think one has to be really careful.
All right. Some theories suggest that kids are low risk when it comes to COVID. Is it true?
So this is the good news. Influenza, when we had the outbreaks, the pregnant women and the young children were worst affected. And we were very worried about what's going to happen to children during the COVID outbreak. Now in USA, they've collected a large number of data. And what they found is that while the population of children under 18 years is 22%, the number of cases in children has varied between 6 and 9%. The number of admissions has been only 3%. And the number of mortalities has been only 0.2%. So we are very lucky that children are less likely to get it. And if they do get it, they are less likely to be hospitalized. And the mortality rate, fortunately, has been extremely low in children.
All right. Until what age is this true? Or is it only 0 to 2?
So infants, unfortunately, the risk is higher. So if you get an infection under 1 year of age, the risk is slightly higher. After 1 year, the risk goes down. And then till 18 years, you're okay. And after that, in adulthood, as you know, that beyond 40, the risk is much higher. So young children and young adults do very well.
All right. But keeping in mind what you said, when will it be safe to send kids to school?
Now, this is one of the really difficult and very important questions. And the problem is that we know that children need to go to school. They need to learn, they need to socialize. It's good for their emotional health, it's good for their mental health, it's good for their physical health. And we should not forget, there are a lot of nutrition programs for the underserved people, and they get a lot of school health meals which improves their nutrition as well. So not going to school is really detrimental. But when to send to school, every country has its own guidelines. And the Scandinavian countries and Germany were the first to implement back-to-school programs very effectively. But they did it when their infection rate was on the downswing. That means when they did testing in the community, the ratio of positives had to be less than 1%. We are far away from that. USA has been a little more conservative, and they said we'll start opening schools when the risk is about 3%. So we can open schools only when the risk in the community is going down, and we have to do it in a very sensible, staggered manner.
Well, I'm sure a lot of people were listening to that particular answer. Thank you so much, all of you, for taking out the time from your busy schedule and giving us your own personal insight. Thank you so much.
Thank you.